Welcome to Season 2 of the Therapist to Millions podcast, where we get under the skin and into the brains of leading therapists and coaches from around the globe to find out what makes them tick and how they are helping those on the front lines of mental health around the world. Hello and welcome to the Therapist to Millions weekly podcast, where we get under the skin and into the brains of the leading therapists from around the world. And all the way from Las Vegas, hot and sunny Las Vegas. Today we have Alicia Runyan, who is the clinical director of Desert Peace Therapy in Las Vegas. Alicia is certified in parent-child interaction, cognitive behavioral, dialectical behavioral therapy, prolonged exposure, cognitive processing therapy, and trauma-focused cognitive behavioral therapy. And she provides quality care to promote the highest quality of life, helping her clients seek relief, happiness, and to live mindfully. She's a wife, mother of 2 children, expecting a third on the way. Congratulations.
Thank you.
And her free time, she loves to spend time with her family, going hiking, camping, and relaxing by the pool. Alicia, welcome to the show.
Thank you for having me.
Thank you so much for joining us today. Now, give us a little bit of a background. I mean, I kind of get the Desert Peace Therapy.
Yeah.
I've seen Las Vegas. I've seen what it looks like. But that's obviously fairly recent that you started that. So give us a little bit about your journey.
Yeah. So I had been working for multiple agencies, for the past 5 years. I'm fully licensed now, and I really wanted to create a private practice that emphasized evidence-based therapy, but also emphasized parent-child interaction therapy, which is one of the styles of therapy that I'm certified in. And it is not a very, very popular style of therapy, unfortunately, out here on the West Coast. They utilize it a lot on the East Coast and even in the Midwest. So that is primarily what my private practice focuses on, working with, little kiddos as old as 2, all the way up to adults. We do individual, family, couples. It's kind of like an all-encompassing center.
Mm-hmm. And what was your background in, how did you get into therapy in the first place?
Yeah. So my bachelor's was in psychology, and I graduated. I moved around with my husband to, different places in Nevada, Salt Lake, Denver, and then eventually Boise, Idaho, where I was hired as a psychosocial rehabilitation specialist. It's quite a name.
Wow.
Yeah. And so essentially what the job is we assisted refugees, because apparently Boise, Idaho is a main hub where they would receive a lot of refugees, and then you would kind of have to help them settle into life in America. So we would we would help them, with coping skills, basic living skills, case management skills, teaching them, this is how you go through your mail. This is how you sort your bills. These are the coping skills you can utilize in real life that your therapist is talking about in session. We would connect them with interpreters and then resources all within the community. So it was really cool and an extremely fulfilling job. And you'd actually go into their homes. So it was a different setting than, our clinical setting, where they come into your office. The relationship is different because you're meeting these, their entire family. You're working with their entire family. You may be the only American that they really know. Like, you're sort of like their lifeline. And so I really enjoyed my role. I loved it. And then I kind of wanted to progress. And so I applied to graduate school. I got into University of Nevada, Las Vegas. We moved back to Las Vegas. And I did my master's program in social work so that it could kind of pair. Like, I could do the clinical component, and then I can also recognize like the family system and how important resources are.
Love it. Now, we're in the UK. Boise, Idaho is famous for Russell Brunson and ClickFunnels. Do you know Russell Brunson and ClickFunnels?
I do not.
Oh my goodness! Right, he set up this thing with ClickFunnels, and he always talks about Boise, Idaho. So it's like, and we never heard of it before. So
that is too funny. The most I knew about Boise, Idaho before moving there was that they had a lot of potatoes, and that one of my favorite fast food restaurants, Five Guys. I don't know if you've ever
We
heard of
have
them.
that here. We love that. Oh my
Okay,
goodness.
they get all of their fries from Boise, Idaho.
Oh my goodness, that's amazing. Well, yeah, I love that chain actually. It's one of my favorite fast food restaurants.
It's very
Let's go let's go into your practice a little bit. So when did you set it up?
So I started setting it up January 2022. And as you probably know, it takes quite a while to build.
Yeah.
And so what I was doing is I would work a couple days in my private practice and then a couple days at another agency. And I was kind of going back and forth. It takes a while out here, at least, to get credentialed with insurances and all like the back house stuff that you have to have set up. So it took me about a year to get to a comfortable place where I was getting enough referrals that I could say, okay, I can leave my steady job and I can kind of branch out and, start my private practice on my own and be completely by myself.
What's the biggest challenge you are facing in your practice right now?
I would say that Nevada, bless our heart, does not have a lot of mental health resources. Insurances are extremely difficult to work with. And then there's just a lack of resources for people in general. So if you're working with a certain population, anyone who's lower socioeconomic status, there's not a lot of options for them. And it's difficult because, my core foundation is a social worker. I want to try to help. And I know that, you can't talk about or process trauma if this person is at risk for losing their housing, or if the kids don't have food to eat, or if there's high conflict and dysfunction in the home, but there's no resources to kind of wrap around and support the family. So I would say for myself, that's a barrier that I've run into. Just with the state sort of being behind, but hopefully that will change with, the focus being on mental health these past couple of years.
Do you know roughly how much funding there is available for each state?
I do not know. And that should probably be something I put on my list to research. I know that the Department of Family Services, who I've been working closely with, they have been trying to get grants in place, and it's been quite tricky. And I've been working with specific people for this Family Prevention First program, essentially. And it's where the state would kind of refer to outside practitioners to get in front of like families losing custody of their children, or kind of help them sort out conflict so that it doesn't get to a point where the state has to get involved. And even funding for a program like that has been quite difficult. So I'd imagine it's a work in progress, we'll say.
It's a good opportunity, I think, for you to put out some resources, some free resources for people as well.
Absolutely.
Yeah. What in terms of your own mental health? We mentioned it in the intro. What do you do to look after your own mental health and well-being?
Yeah, from an early point in my life, I've always utilized supervision. And I've been very, very lucky to have amazing supervisors and mentors throughout my journey as a therapist. In my graduate program, they highly emphasized the value in supervision and the value in like training and kind of knowing what you're doing. I'm able to kind of contact my supervisors to staff cases that have been really difficult for me, or if I feel like I don't know where I'm going. Aside from, my professional life, my home life, I have children, we have dogs, we're quite busy. We love going camping. My husband is very outdoorsy, so he drags us along in the camper, and it's kind of nice to disconnect and not have your phone and not think about anything, and go out in nature essentially.
Yeah, absolutely. Absolutely. So if you had like a top tip in mental health at the moment, obviously get outdoors more, get some vitamin D, get some fresh air, get some oxygen. But what else would you suggest to people looking after their own self-care?
And have a fabulous supervisor, I think. Have somebody that you can go to, somebody that you trust, somebody that I was able to do weekly consultations with, and even still now fully licensed, I have like a group of therapists where, we'll go out for dinners and just talk and, vent and validate and support each other. And I think that that's really important, because this can be an extremely taxing job, and it can be an extremely lonely job as well, especially in private practice if you're not working with anyone else. So I think it's good to have a strong community.
Now, using some hypotheticals and not using any identifying factors, what's an example of a specific success story in your practice?
Yes. So I was going to talk about parent-child interaction therapy, because I know that a lot of people utilize CBT, DBT, CPT, TFCBT, right? But PCIT is not a therapy modality that I think is as popular. So with PCIT, parent-child interaction therapy, I see kiddos as young as 2 years old all the way until 7. And the case I was going to discuss was a little boy. I'm going to just call them Johnny, just for the sake. So Johnny was about 5. He just turned 5. He'd been kicked out of multiple preschools and was causing his parents a lot of turmoil and headache. Johnny is going to start kindergarten this year, actually. And his mother had to essentially quit her daytime job because they could not keep him in school. He was hitting, running out of the classroom, biting, throwing things, and he was just a danger to the other kids and the teachers. And so when Johnny came in for an assessment, his parents were just completely, they were hopeless. They didn't know what to do. And so during the assessment, the way I started off is it's just a basic assessment. We gather all of the identifying information, history of symptoms, discipline, schooling history, everything. And during the assessment, I had a bunch of toys kind of set out for little Johnny, but he was not interested in any of my toys. He just had his iPad. And about, I'd say, three-fourths through the assessment, he wasn't able to figure out a level that he was playing with on his iPad. And he actually started digging his nails into his mother and pulling on her face. His dad tried to calm him down. He started spitting in his dad's face. And so I was able to see very quickly the nature and what we were dealing with. And as parents, they had no control. They didn't know what to do. So he is a perfect candidate for parent-child interaction therapy. The goal of the therapy is to really reduce problematic behaviors. And the way the layout of the therapy is, it's divided into 2 phases. So the first phase is going to work on the attachment bond between the parents, and reinforcing appropriate behaviors, and then also reinforcing the child's ability to follow directions, pay attention, focus, and then become cooperative. And then the second phase of therapy is called parent-directed interaction. And this phase focuses on effective communication and consistent discipline patterns that don't include spanking, yelling, hitting, nothing aggressive or violent. So what we ended up doing is I had a teach session with the parents following our assessment, where I taught them pride skills. And so pride skills consists of Pride is the acronym we use just to help people remember. So P is for praise. So we teach the parents how to label praise their child, praise appropriate behaviors to reinforce appropriate behaviors. R is for reflect. So we teach parents how to reflect or paraphrase appropriate things that the child is saying. And this enhances like their self-esteem. This lets them know like what they're doing is okay, and increases like speech, vocabulary, concepts. I is to imitate. Imitate. So PCIT is a play-based therapy. So parents are going to play with their children in therapy, and they're going to use these pride skills. So when we teach them imitation, we teach them like, hey, if your child is coloring, you're also going to be coloring. If they're playing with blocks, you're playing with blocks. D is we teach the parents behavior descriptions, which is an extremely powerful skill in turning like a child before they enter into tantrums or problematic behavior. So behavior description could look like, you're coloring with the blue block, or you're coloring with the blue crayon, I mean to say, or you're sitting so nicely in your chair, you have your hands on your desk, you're working on your homework assignment. These are all behavior descriptions. And then E would be to enjoy or to show enthusiasm while they play. So essentially what we're doing in the first phase of therapy is teaching the parents how to play with their child and how to utilize these pride skills, and then how to generalize them into real life. So it's not that, they're putting a blue block on a red block, and that's really great. It's that they're learning the skill so that they can say like, you made such good choices today, or I can see that you're feeling angry. Thank you so much for telling mommy instead of hitting mommy, right? These are the skills we're kind of trying to convey, and it's easier for everybody if we teach them in play first, because that's how kids learn. So with this particular kid, little Johnny, I could tell that he had such anxiety. He would always want to control the situation. And his parents were so afraid of his behavior outbursts that they allowed this to happen. So they would give him the iPad whenever he wanted, just to kind of like calm him, which would just reinforce his problematic behaviors. And they were having to modify their entire lives. Like they couldn't go out to eat. They couldn't really go out in public. They stopped spending time with their family. They had gone on a family vacation and were staying with a family member, and were actually asked to leave the family member's house, and they had to resume their vacation in a hotel room because the child's behaviors were so significant. So what we do is we teach them the pride skills in play, in sessions, hour-long sessions in therapy. And then we instruct the parents, okay, so now I want you to have special time with your child for 5 minutes every single day where you're utilizing these core skills. And that's all I want you to utilize. The play might seem weird. The play might feel uncomfortable, but as you learn the style, it'll become habitual. And so just in the parents doing the special time with him every single day and giving him the positive reinforcement, we saw a significant change in little Johnny's behavior. He loved coming to therapy because he got to play with his parents and he got 100% of their attention. And then the parents started to feel more confident because they had a plan and they knew how to problem solve. I also was teaching them the skill of active ignoring. So what they would do is any minor attention-seeking behavior, I would instruct the parent to completely ignore, as if, they didn't even know Johnny was screaming at the top of his lungs for the iPad, or if he was saying rude things to them in session. They would turn their back, they would continue to play, they would use behavior descriptions on themselves of what they were doing. Mm-hmm. And the second he stopped, they would turn towards him and use a pride skill. Like, oh, thank you for sitting there so quietly. Now we can continue playing. And so this was teaching Johnny what behavior was appropriate and what behavior was not appropriate.
Yeah.
And then they learned how to generalize this into their home life, which also helped teach Johnny what was acceptable. And he started to learn boundaries and limits. So then enters, once the parents hit mastery of these skills and they feel very comfortable, then we enter the second phase of therapy, which is called parent-directed interaction. And that's where we teach parents really effective communication. So they learn the difference between an indirect command and a direct command, such as indirect command would be like, let's sit down. Should we sit down? Let's clean up. A direct command would be, please sit down. Please put all of the blue cars into this bin, right? Like letting the child know exactly what you want and that the child is the one to be asked to carry the task out, not the two of us. And so following the direct commands, we teach parents in this particular family a very distinct timeout protocol. So families know exactly what to do. They know exactly the steps to follow. And they know that, if the child doesn't listen the first time, this is what I do. This is how I can handle this problem. And so little Johnny actually responded extremely well to the second phase of therapy, because I think he started to learn like what was the expectation, what was expected of him. And then when he met the expectation, he was given a labeled praise, which made him feel really good. So now he knows, here's the expectation. I did exactly what my parents asked. They feel good, and also I feel good. And so we were able to complete the therapy in 14 sessions, which is pretty typical. PCIT can range anywhere from like 8 to 22 sessions. Every week we administer an assessment. It's called the Child Behavior Inventory, which essentially lets us kind of monitor typical problematic behaviors in kiddos 2 to 7 years old. And we generate a score. And so if the score continues to rise, we know, okay, hey, something's not going right. I, as the therapist, am missing something, or I'm not explaining something in the way that this family needs to understand. And I've got to kind of look at my approach. I've got to dig deeper. I've got to problem solve. I've got to help them. And so it's a tool that kind of helps us guide therapy along. And so this type of therapy is highly successful for families in giving them the skills that they need to, function and enjoy each other's company and love spending time with each other again.
I love it. That's brilliant. What a great case study as well.
Yeah.
Now, when it comes to marketing your practice, what are you currently doing?
So, because my children are little, when people ask me what I do, I proudly tell them. And so the preschools that my child goes to, they were like, wow, this sounds like something we exactly need. So I was able to give them information and handouts. And so they've actually distributed my information to like all of the preschools under, that sector. And so I've been getting a lot of calls that way. Brilliant. And then because the therapy style is evidence-based, the state actually recommends quite a bit of kiddos over to me. And since
great.
There's people certified in this style of therapy, I've had a lot of success. I also utilize Psychology Today, which has been so wonderful for me. I haven't had to do a lot of marketing myself. It's sort of been like word of mouth. And I think as my practice grows, I would love to embark on marketing to just different doctors' offices or pediatricians and kind of letting them know what we do.
Well, speaking of expansion, what are your plans for growing the practice?
Yeah, so right now it's kind of like a 3-step. It's the first step was establish the practice. The second step is going to be, okay, let's maintain and kind of work in this setting for about a year. I'm also having a baby soon, so I decided to just kind of throw that into the mix along with starting a practice.
Oh my goodness.
Yeah, so I think for the next year, I'm going to see where things go and settle into my new family life.
Yeah.
And then hopefully within another year, hire some therapists and kind of expand.
Yeah.
That's my goal.
Fantastic. Now, if you could write a book, what would the title be? Or if you've already started writing a book, what's the title?
Yeah. So I'm probably not as clever as the other people I've heard on your podcast before. And I thought hard about this. And so my main focus in therapy is behavior modification, and then also recognizing like cognitive distortions and the power that our perception has on things, and how it can really, in our thoughts, can really influence our feelings and our actions and our behaviors. So I would probably go with something like reframe your thoughts starting today, because I just think that reprogramming our thinking, whether it's about parenting or just our perception on life in general, is so beneficial. And it's so versatile, and it can kind of help every single person it encompasses.
Absolutely. Now, on the subject of books, what's your favorite therapy book that you've read?
Yes. So there is this DBT therapy book that I utilize. It's called Adolescents with DBT, and it's by Alec. And for some reason, I forgot to grab it right before we started. I forgot to pull it out, but I utilize it in almost every single case that I have. For and if you give me 2 seconds, I can grab it.
Sure.
Almost every single I have. Oh, here it is. Sorry about that. It's called DBT Skills Manual for Adolescents by Alec L. Miller. And I utilize this book for group therapy for teens that are emotionally dysregulated, any teens that have problems or conflict with their parents. The book is such an easy read, and it has handouts for your clients, which I love to give people handouts and something to take home with them. It has homework sheets, practice assignments, and then it also gives the therapist such a wonderful way on how you could present the information. I think it's really powerful, and I love this book.
Fantastic. We'll include that in the show notes, a link to that, and it's another one to add to our library because we haven't seen that one before.
Yes.
Now, tell us a fact that blows our minds, or tell us a joke that's one of a kind to win your 3 months free membership to the Therapist to Millions.
Okay. So my facts are going to be Las Vegas based, because we love having tourists come and visit our city. So, and this is probably a given, Las Vegas has the most hotel rooms than any other city on the earth. Yes. Yeah. But it's also the brightest place on earth. It's not great for stargazing. And then the bronze lion that sits in front of the MGM, which is like classic. You think of the MGM, you think of the bronze lion, is actually the largest lion in the world.
Oh my goodness. Wow. I didn't know that. Or certainly about the brightness as well. And I didn't even know the hotel rooms, but I could guess that one. Brilliant. Well, 3 months free membership coming your way. That's definitely blown our mind. And finally, how can people get hold of you?
Yes. So Psychology Today is where most of my clients reach out to me. You can find me, Alicia Runyan, LCSW, or my website, www.desertpeacetherapy.com.
And you're also available on social media?
I don't have social media at this time. I know I'm one of like the anomalies, but in the future, I will work on that.
Well, you're lucky because Dr. Susie and I are running we're doing an update of our TikTok module from the Therapist Millions. And because Dr. Susie's had nearly 1 million views on one of her TikToks now on narcissistic behavior. So, and I'll tell you, straight hot off the press, it's on the 10th of July. So your membership's going to cover that. So you can watch that with us. You can be part of it. So yes, also, if you're listening to this, it's 10th of July. We're updating our TikTok module on the Therapist to Millions membership. So yeah, be part of that. Come along and have a listen.
That is wonderful. Thank you so much.
Fantastic. And I thank you for taking the time out of your busy schedule. Thank you for everything you're doing on the front lines of mental health. We really appreciate you and your work.
Thank you so mumuch. It was such a pleasure to be on here and speak with you.
Wonderful. And you take care. Thanks, Alicia.
Okay. Thanks. Bye.
Bye. Bye. If you would like to take part as a guest on the Therapist to Millions podcast, simply email me, damien@therapisttomillions.com. That's Damien with 2 A's, as all of the guests on the show will get 3 months free access to our Therapist to Millions membership worth $300. So if you would like to know how to write a best-selling book, secure a TEDx talk, create membership sites with content you don't even have to create, build client acquisition funnels, effective lead magnets, or your very own podcast, and way more besides, why not head over to thetherapisttomillions.com and join our community of like-minded professionals? And if you'd like an additional $20 off your membership, simply type in the coupon code PODCASTLISTENER at the checkout.